Good afternoon. I am here with Derek Goebel from Altru, and he is the CFO and a veteran. And first of all, the U.S. Veterans Magazine wants to welcome you to our editorial opportunity here, where you are being recognized as a top MilSpouse employer. And we'd love to know a little bit more about you and your organization. And I really appreciate your time today.
Yeah, and thanks for having me and for the recognition for Altru. So, I'm a North Dakota kid, and so I continued to live here in North Dakota, and actually was born in the hospital in Grand Forks that we recently replaced with a new flagship hospital. So it's a tremendous honor to work for an organization that I've really been around most of my life. My wife Rachel and I, we have one daughter, Grace, and we live right here in the community of Grand Forks, where I serve as Chief Financial Officer for Altru. I joined Altru in 2010. I was in a planning and development role at the time, and I've sort of worked my way through the organization to the seat that I'm in now. My time in the service started it was July of 2001. So just before the attacks on 9/11, that I joined the North Dakota Army National Guard, and shortly thereafter, I spent some time in the Middle East in Iraq. I was there 2004 and 5 for about a year, and then I spent some time stateside on another mobilization later in the enlistment, and I served a total of 13 years in the service.
Thank you for your service.
Thank you.
Absolutely, that says a milestone about you. You know, about 2 years ago, you actually launched the Veteran Employee Resource Group for Altru. What inspired you to start the ERG, and what was the original vision behind it?
Yeah, we shortly after I was named CFO, we had a group of employees who were veterans, and also some others across the organization that got together, and we wanted to do a whole wide range of things, and we talked about insurance struggles with VA, real serious topics, and we talked about recognition and fun things that we could do, and born out of that was the Veterans Employee Resource Group, or ERG, and we meet quarterly. We're focused really on, primarily we started our focus on the internal folks here at Altru, right? Employees that were veterans or currently serving, maybe in the reserve or the guard. And we have since expanded that a bit to include employees that are simply interested in how they can support veterans and further recognition. And then we've over time evolved to recognize community member veterans, and really just an opportunity to bring those groups together and share stories, share ideas, and think about how we can make things better for veterans and service members.
Are there other goals besides sharing that
Sure.
employees utilize? Can you share a little bit more about that?
Yeah, one of our goals, of course, is retention. We're in healthcare. Healthcare is a tough job, and we've got about 3,500 employees here at Altru, and a little more than 100 have let us know that they're veterans, because of course it's optional, and so we know that we've got to retain talent, and while I love Grand Forks, North Dakota, not everybody wants to live in North Dakota, and so we know we've got to create opportunities for these folks to come together and see that they have a connection to each other inside of Altru, so that while we want them skilled and able to do whatever they want to do, we want to give them an environment and create a camaraderie among one another that makes it so they don't want to leave. And that's certainly a goal. That retention of our team members is critical.
And I know that ERGs benefit both the veterans within the organization and Altru as a whole. Can you expand on that a bit?
Sure. And so, as I've said, I think honestly, just the coming together of folks that identify as a veteran has been critical. And not everybody had the greatest experience in the service, and obviously a very wide variety of different experiences and different services for that matter. But there is a connection that's made when you can talk with others that have had to move their family, traveled across the world, been in dangerous situations, gotten to know folks that that are a completely different background, and not everybody understands that, and veterans do together. And so I think that's really helped our employees engage with it. We also give everybody a little pin, and we have a veterans breakfast that we host on Veterans Day. And so we do some fun things like that. But also it's really just about the organization's leadership, myself included, to be given the opportunity to say thanks. And we're a veteran friendly organization, and happy to be so. We've also been recognized as an organization a few different times over the last couple of years, locally and nationally. And so the attention that we see from that not only helps us retain our employees, but certainly recruit new talent that may be transitioning out of the service. And North Dakota Cares is a local organization that's out of the governor's office here in North Dakota. They recognized us. We've been recognized by the ESGR. We're a military-friendly organization. We carry that designation. And then we also recently joined participation with the U.S. Army in their PAYS program, which actually helps transitioning soldiers find skills and have access to jobs that meet their MOS or align to their MOS when they transition from the Army. And we're a participant in that program as well.
Excellent. It's obvious, Derek, that you've created a culture that's comfortable for veterans coming in. I think that speaks volumes. Altru also, and I think this is very unique, you ask patients who are veterans if they'd like another veteran to visit, to sit with them or support them during their hospital stay. And this to me is really amazing and unique. Can you explain how this program works and the value it brings to the veteran patients and their families?
Yeah, absolutely. And this is something we started maybe a year ago. We, like many hospitals, we have volunteers, community members that are unpaid, and they wanna support folks that are in the hospital. Anybody that's been in the hospital or had family members in the hospital knows it's not always the greatest time, right? It can be scary.
Yeah.
You don't know what's going to happen, and it can be kind of lonely at times. And so we ask patients upon admission if they're a veteran, and if they are, and they'd like to be visited by one of our volunteers, a volunteer will go up. We give them a coffee mug. Who doesn't love a coffee mug? And just sit and visit with them about anything. And there's again, that camaraderie piece comes through. We see conversations ranging from, yeah, where have you been and what have you done, to your kids and your family, and hopefully give them a sense of comfort, maybe take their mind off of what's brought them to the hospital in the first place for a little time. And it really helps those patients see that connection and that support. And I would bet if we asked all of our volunteers that do it, our volunteer veterans might get more out of it than the patients do. It's really fun. We were front page of the paper and on Veterans Day for the work that we're doing, and it's really been really rewarding, frankly, to create that recognition and really just provide veteran patients with a sense of ease that maybe they wouldn't get without a connection to a like-minded or like-experienced anyway individual.
And you're right. Sometimes someone just needs to be heard.
Yeah.
It's amazing how just listening to someone and hearing them, just let them talk. It's amazing what that can do for them. And when they're talking to someone that they feel they can trust, or at least share some of what they're going through, it speaks volumes.
Yeah, we have a wait list of volunteers that want to participate.
Oh, really? Wow.
There's just so much interest in the program, and that care for the patient that those of us maybe that aren't in the direct patient care space get an opportunity to do in this bedside visit that as I said, is very rewarding and fills the bucket.
Well, besides your ERG and this bedside visit and this culture that you've created, tell me about how you support the military spouses in your workplace. What programs and practices do you offer to help the spouses onboard and grow and remain within the organization? And if you want to share any success stories or testimonials.
Sure. Absolutely. So we, here in Grand Forks, North Dakota, we are just 16 miles from the Grand Forks Air Force Base. and we are the sister city to the Air Force Base. And actually, just last week we met the new wing commander and his spouse, as well as the rest of his command team and their spouses. They were all here for a visit, and with myself and our CEO and our president. And we have over the years employed many military spouses that have had family members and loved ones at Grand Forks. And when that order comes to move on, we do what we can to retain them. And certainly if they're at the bedside, hands on the patient, that can be tough. But we have lots of roles in the organization, in particular in our business office and some of our back office functions. And we actually have a denial coordinator. Her name is Michelle. And she started working with us when her husband was at Grand Forks and then was PCS to Mississippi. And we gave her a laptop and we gave her some computer screens and we said, keep doing what you're doing. Do it from Mississippi. She's still with us today.
Oh, wow.
And
That's
these
great.
are complicated jobs. Healthcare finance is a complicated job.
Yeah.
So she still gets to connect with patients, provide guidance, push on insurance companies that are denying appropriate care, and we get to keep her, and she gets to stay with us, and wherever her next stop takes her, I hope she continues to work with us.
Oh, that is wonderful. Well, it sounds like you have an amazing program there, Derek, that you head up. And I want to thank you, so much for your time today. But I always ask this last question is there anything else about you, the company, the organization, or veterans and spouses that you'd like our readers to know? Anything else?
Absolutely. Altru, like lots of community health systems, we're an independent system. We are community owned, non-for-profit, and we exist to serve the community. And so to connect veterans who spent their careers maybe before they moved into the civilian force serving, to make that connection and bridge between serving a community and serving the nation is an easy connection to make. And so we want to make sure that veterans feel that sense of duty and continue to feel that sense of duty and service through all of our programs. Because if we don't have a community to serve the patients we serve, that's critical. That's our customer, right? That's what we exist for. Veterans slide right into that role very easily. And so makes for a nice connection.
Absolutely. And again, I want to commend you again for all that you do for all the veterans and for your service. And congratulations again for being a top MilSpouse employer.
Yeah, thank you. Thank you very much.
Absolutely.